All right, let's move on. Next topic, Dr. Cole, overtraining and overuse injuries in youth athletes. And boy, we see it so often. How often in your office?
It's a particular concern, Steve, especially as we're approaching the spring. We have a lot of our youth baseball players. Sometimes they're playing in 2 leagues. They haven't had proper rest. So this is it's a real problem that we have. You know, obviously we have these acute traumatic events that you and I can't control for, but this is something that's avoidable. And as long as people recognize the signs, the symptoms, and intercede, you can prevent it.
Our next guest is a clinical director from Ivy Rehab Physical Therapy. They do a marvelous job. He's out of Oswego. And talking a little bit here about the overtraining, overuse injuries in youth athletes, it's Justin Velarde. Justin, thanks so much for joining us here on Sports Medicine Weekly. Let's jump into it. What is overtraining, in your opinion, and what are some of the signs associated with it?
Absolutely. Great question, guys, and thank you very much for having me on the show. So typically overtraining is when an athlete's trying to gain a competitive edge by either increasing the sports they play, by playing on multiple sports teams, by training too much, too often, too many repetitions to try to gain that competitive edge. And in reality, they're actually hurting themselves because they've now created a problem with increased pain and declining performance. They may feel weaker. So that's the signs and symptoms kind of associated with overtraining are that muscle pain, joint pain, decline in performance, just feeling tired or having a lack of energy, and then there's other symptoms that can even include loss of appetite, kind of mood irritability. So yeah, some of those signs definitely would trigger some overtraining.
So Dr. Cole, let me bring you in on that, okay? So Justin's talking a little bit about signs associated with it, and he's talking about pain and things. When does it become injury, in your opinion, then?
Yeah, it's a tough one because it's probably joint-specific, probably different exercises or participation in sports could lead to variable problems. And I think that, and Justin, I'd be interested to know your thoughts, there's a concept of sort of delayed onset muscle soreness, which could potentially, maybe it's insufficient recovery, what have you, and maybe sort of inhibit your next workout, versus the kind of overtraining that they just ignore their signs or their signals and they get, say, a tendonitis or an injury that they can't get out from underneath no matter how much they rest. And I assume that that's your bigger concern, right? So working out, having this delayed onset of muscle soreness and so forth, you had a really good, strong workout, maybe you could minimize that by good recovery techniques. But should I assume that what you're alluding to is this excessive exercise or participation in sports that actually leads to something that might be akin to injury? Is that fair to say? Absolutely.
Yeah, that overtraining, that rather than having the soreness that you can kind of push through, and if we're speaking of a pitcher specifically, a pitcher can kind of work through, and maybe he's sore afterwards. But now he's been overtraining, he's been throwing too much, too hard, too often. So now he's looking at he's developed an injury where now he's out for weeks, maybe a month or so, because he's been training too hard and too often.
Yeah, and I think one of the problems is that people sort of associate training with skill and competence. So I'm interested in your thoughts. I think that's one of the things that we have in our overhead athletes, that people pitch to pitch, they pitch to pitch well, and they're constantly practicing. And that's when I see kids get into trouble, especially these younger kids who have open growth plates where they get what we call little league shoulder or little league elbow. Those are often overuse or overplaying issues. I'm curious, why do you think our young athletes are susceptible in the realm of overhead injuries to the shoulder and the elbow?
Well, just there's so much force generated by the overhead throwing motion that a young athlete, you need good mobility throughout the shoulder complex and great stability of the shoulder complex, your scapular muscles, your shoulder muscles, and your upper extremity muscles to kind of combat those forces and withstand good mechanics with a throw or a pitch. So typically in the adolescent athlete, just the body is not developed quite yet, not strong enough yet, doesn't have that support and the stability throughout the shoulder complex to just be able to withstand all the repetitive throwing.
Again, we're visiting with Justin Velarde, Clinical Director for Ivy Rehab out of the Oswego facility. I'm Steve Cashel with Dr. Brian Cole at sportsmedicineweekly.com. Our website is sportsmedicineweekly.com. And Justin, so tell us more about Ivy Rehab. Since we have you on, people come in for screenings and the like. What do you do when you see someone who may have a overtraining, overuse injury?
Well, I think education's key, first and foremost. You need to educate the patient, the athlete, let them know kind of what's going on with their body, why their body may be reacting to some of this overtraining, whether that's exercise or more sport-specific and just playing too much. So getting and the young adolescent athletes, mom and dad need to be aware of the signs and symptoms also, and just educate both the athlete and parents, and really let them know that when it comes to overtraining and developing these overtraining injuries, that rest is key. Just we need to make sure that athletes are typically getting 1 to 2 rest days a week from competitive athletics, and then even throughout the year that their body is getting maybe 2 to 3 months break from a sport, from the same sport, where their body has a chance to recover and try to heal up from some of those repetitive motions throughout the season.
Dr. Cole, I was with the group from Ivy Rehab. We all were entertained at the Chicago Steel hockey game up in the Fox Valley area a couple Saturdays ago. Had a great time, and I thought they had like 30, 35 locations. They're over 200 now, and they're raving about you and some of the things you've done with them. I know.
They've done a terrific job. Look, let's face it, it's a very competitive market. And I would say that what happens is that sort of the cream rises, and I've had a great experience with my own patients when they go there for treatment. They emphasize quality and they spend the time, and they're seeing the same therapist on a repeated basis. There's lots of complaints that patients might have about therapy, and I think they've identified them, and it's a one-on-one approach, and it's very high level, and the competency, such as the individual we're talking to, Justin, is extremely high. A lot of them are doctorate in PT and so forth, so that goes a long way, and it doesn't go unrecognized. IvyRehab.com
is their website, IvyRehab.com. Justin Velarde, our guest from the Oswego facility. Hey, Justin, thanks so much for being a part here of Sports Medicine Weekly on this Saturday.
Thank you very much, guys. It's been a pleasure.
All righty. Back with our Ask the Doctor segment. Always fun. We'll tell you how you can get involved. Ask Dr. Cole a question. So stay with us. It's Sports Medicine Weekly, only on
670 The Score.